welcome back to my channel, guys. Today let's see about the repeatedly asked topic in the Neet PG orthopedics का subject में, that's median nerve. So let's see, let's understand it in a very simple way, so you guys can answer the question as soon as you see some clue points there. So to start with, let us quickly understand its anatomy. So the root value is C5 to T1 and it is a mixed nerve. So there is a motor supply and sensory supply, as you all know. So let us decode these things. Basically, you have to remember two things in the motor supply. It is supplying forearm anterior compartment ka muscles. In forearm, it is supplying anterior compartment ka muscles, and those are mostly flexors. So that includes flexor carpi radialis, pronator teres, palmaris longus, flexor digitorum superficialis, and flexor pollicis longus. And you can also see, yeah, lateral half of flexor digitorum profundus. So like this is it's iska motor innervation. So now you can't remember all these things, so it's simple. Just remember, except flexor carpi ulnaris and medial half of flexor digitorum profundus, all the flexor muscles are supplied by medial nerve. This is what you have to remember here. And in hand, you that is supplying thenar muscles. And what are those thenar muscles? Opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis. Here also you have to remember one exception, that is, except adductor pollicis, it is supplying all the thenar muscles along with lumbricals 1 and 2. So this is its motor supply in brief. Coming to its sensory supply, it is supplying lateral 3.5 fingers in the palmar aspect, and in the dorsal aspect it is supplying only the tips. This is its sensory supply in brief. So let us just have a quick recap. At the flexor retinaculum, this median nerve divides into deep branch and superficial branch. That deep branch is giving motor and sensory supply. Motor is for thenar muscles and sensory is for lateral 3.5 fingertips. And the superficial branch is giving only sensory supply to the palmar area. So this is what you have to remember in brief about anatomy to just diagnose all the other conditions. Fine, let's get into the levels of injury now. So now let's see, there is at wrist, you can see, let's understand this table and then you can answer all the questions that are asked. Fine, at wrist there is, suppose you have a carpal tunnel syndrome. So carpal tunnel syndrome, just remember, there is deep branch ka compression, like at flexor retinaculum, when the deep branch is compressed, then that is called carpal tunnel syndrome. Now you can easily guess, if the deep branch is compressed, what is lost? Thenar muscles, yeah, that is thenar muscles, and wasting of thenar eminence is seen, and sensory supply is lost. Yeah, lateral 3.5 fingers ka loss of sensation also seen, and there is also, it is supplying hand muscles, right? So thenar muscles. So adduction, loss of thumb, abduction, flexion, and opposition. So this gives you ape hand or thumb deformity. So this is not the exact picture. Don't see this. I'll show you the pictures. So this is how you have to memorize it. Carpal tunnel syndrome, deep branch ka injury. What does deep branch supply? Thenar muscles, lateral 3.5 fingertips. Everything is lost, and also you also lose hand muscles, thenar muscles ka function. So that's the reason you are, like, it is giving ape hand or thumb deformity. Now let's come to at elbow. So at elbow, what's happening? There is supracondylar humerus fracture. At elbow, you have to just remember three muscles: flexor pollicis longus, flexor digitorum superficialis, and flexor digitorum profundus. And in that, as I've said you, flexor digitorum profundus only lateral half, medial half is supplied by ulnar nerve. That is another case, right? So that we also call it as high median nerve injury. Just remember this, we can, like, it can be asked in the questions. Fine, so what does a motor deficit see? see, it's all along with wrist level manifestations that we have seen in the this box. And there is something called inability to make fist, that is pointing index or benediction sign. Fine. And yeah, all as seen in the wrist level manifestation, there is loss of sensation. Yeah, similar. So index finger is not flexing, because for flexion of this index finger, it needs flexor digitorum superficialis and flexor digitorum profundus, right? So when these muscles are not functioning good, yeah, there is some injury at this level, the index finger can't flex, so you see pointing index or benediction sign. Yeah, this is what you have to remember at elbow supracondylar fracture. Now anterior interosseous nerve. Anterior interosseous nerve के बारे में there is only two things you have to remember, that is it is only supplying motor nerve, so there is no sensory loss here. So that motor nerve also, it is supplying flexor pollicis longus and lateral half of flexor digitorum profundus, so that's the reason you don't have any sensory loss. And the very important thing you have to remember here is difficulty to make okay sign is seen in anterior interosseous nerve ka injury, so you can call that as weak okay sign. So if you remember this table, you are almost done to solve everything that are asked in a median nerve question. So that important points to remember here is in anterior interosseous nerve ka palsy, you see weak okay sign. This is a very pure motor. And carpal tunnel mein you see motor plus sensory, ape thumb deformity plus wasting thenar eminence plus loss of sensation of lateral 3.5 fingers. And in high median nerve injury, that is at elbow, you see motor plus sensory wrist manifestations along with inability to make fist, that we call it as pointing index or benediction sign. Now let's see what are the questions that can be asked with this concept, and let's see if you guys can answer it right, and comment if you guys got that correct answer. So let's get back to the questions. Fine. See here, it's a weak okay sign. In the right side you can see the index finger and thumb are touching, like tips are touching with flexion perfectly, making an O. In the left hand side you can see the thumb ka flexion, I mean inter joint, and the index ka joint is not flexing as seen in the right hand side. So there is weak flexor digitorum profundus and flexor pollicis longus, which are supplied by anterior interosseous nerve. So that's the reason we get a weak okay sign. You can see here it's little diamond shaped, it's not O shaped. So this is what weak okay sign means. And this is a picture of ape hand thumb deformity. It is seen in carpal tunnel syndrome. I have already discussed about this with you. So let's see about the questions now. Okay, don't read the question here, just look at the picture. And this is pen test, and they may ask you this test is performed for which muscle or in which nerve testing, so they can ask you both muscle and nerve. So see, this is pen test and this is performed in median nerve, and the muscle here is abductor pollicis brevis. You just have to remember this. And let's get to another question. A 32-year-old man sustains supracondylar fracture of the humerus. Okay, he complains of numbness over the palmar aspect of the lateral 3.5 fingers. On examination, there is wasting of thenar eminence, and he is unable to flex interphalangeal joint of the thumb and distal interphalangeal joint of the index finger. So, which of the following is most likely site of the lesion? You can see there, other than wrist and sensory loss, you can also see is unable to flex interphalangeal joint and distal interphalangeal joint. So these are the things you can also see here. So that's the reason the medial, and they also gave you supracondylar fracture of the humerus. So you can go with the option high median nerve injury here. Okay, yeah, okay, if you guys find this video helpful, please like, share and subscribe. Share it to your friends who are preparing for